Hello, I'm Dr. Nidhi Gupta, pediatric endocrinologist and digital wellness coach in Nashville. This is Inspinar. There are two occupations in the world that are known to be associated with the highest rate of burnout. Number one, active duty military. Number two, physicians. Our guest today, Dr. Charlene Dewey, is the director of the Center for Professional Health and chair of the Faculty Wellness Committee at Vanderbilt University Medical Center in Nashville, Tennessee. Dr. Dewey, thank you for joining us today.
Thank you. I'm so excited about being here. This is a great opportunity, and I thank you for all that you do for the community.
Thank you, Dr. Dewey. Your latest motto is, I save physicians one career at a time. Tell us your story that led you to become a coach for physicians in crisis.
Well, it was certainly not one of those things I went to medical school thinking I would do. It was definitely one of those blessings God delivered along the way. As I was transitioning from one institution now to Vanderbilt, the opportunity came up for me to work in the Center for Professional Health, which is a very unique kind of place. And what they do there is they have courses, educational courses, that focus on helping physicians who have some sort of a professionalism lapse, meaning they get in trouble for either sexual boundary violations, distressed or disruptive behaviors at work, or misprescribing of controlled prescription drugs. And I was originally consulted to look at their educational process because of my education background. And after going at least once, I kind of like, these are my people. How can I not help my own people as physicians and colleagues? And recognizing that a lot of them had great intentions, a lot of them had, you can say reasons, not maybe justifiable reasons, but reasons in their mind or in their heart that they did what they were doing. And with basic education, with supporting them, with appreciating what they do, I saw them, their light bulbs come on, and they would change and make, different behaviors for their clinic, but not just for their clinic, for them personally and for their families. And so through that process of being at the Center for Professional Health, I realized that physicians need some place to go that's a little more confidential, a little bit more protective, and a little bit more geared specifically to them. And so from there, after I started helping teach physicians, I realized that they needed a little bit more. They needed some one-on-one time, and they needed the feeling that they were safe. And so that's when I started planning to become a coach. Of course, life takes its time, right? My kids were still fairly young at the time, so I waited about 5 years as I investigated different coaching programs and talked to different people about coaching, and was finally able to go through the training in like 2018, 2019-ish time. And so even though I feel like I was in academic medicine, I'm teaching, I'm coaching and mentoring all the time, there was a difference, okay? And so getting my coaching certification and training was that next added piece that took it to the next level. And then I really do believe now that when I get to talk to physicians, I'm blessed and honored to have that opportunity to be someone they trust, and I can actually help save their careers and their family life.
We will dig more into the details of coaching to become a coach, getting the tools to become a coach. We'll dig that more in detail in a little bit. But before that, in your opinion, Dr. Dewey, how do you think we reached a point where we need to be so proactive in saving physicians' career and focusing on their wellness? Because one might argue that physicians know how to take care of themselves because that's what they do for everyone else. So, how did we land in this ironical situation where we need to design programs to help physicians' own wellness? How did we ever sideline that?
Wow. The biggest thing is that saying, do as I say, not as I do, right? To an extent, physicians tell people what to do all the time, but they are such caring and giving people for the most part that they give, and they don't always recognize what they need or how to get for themselves or how to take care of themselves. Now, don't get me wrong, there's everybody on the spectrum, from the couch potato to the marathon runner, and there are physicians, right? So there are some that definitely continue in that healthy lifestyle, so to say, but there are definitely some that, as I say, they're on the rat wheel and they can't get off. They go to work, they get work done. They go home, they get work done. They go to work, they get work done, and continuing, right? And so sometimes it just takes someone to help them kind of get off and recognize that it's okay to get off of that rat wheel sometimes.
So it's important to set boundaries, what we call work-life balance, which is a term that is thrown around to the point where it has lost its meaning, but it has a lot of meaning. So like you said, going home, still working, coming back to work, still working, after putting kids to bed, still working. What are some of the coaching methods that you find effective in your practice that helps physicians think a little bit differently and help them break this cycle of being on the rat wheel 24/7, 365 days?
Right. Well, and in coaching, if I can say, I want to just add a little bit of clarity because when we think about coaching, some think about like the coach of the football team or the coach of the basketball team, and they're out there, do this, do that, stop it, and they're yelling expletives and things like that. Whereas what you and I are talking about as far as a coach is someone who's skilled in the art of helping people discover. Okay, and so in my opinion, that's the beauty of coaching, in that we get someone and we help them discover their own needs, what they want, how to get there, as opposed to a coach or a mentor that's telling them kind of what to do. So coaching, I think, is one of those things that also, when you think about stigma related to physician health and wellness or mental health conditions in physicians, even though for the most part, if a physician has a mental health condition or that burnout, they're not going to lose their job because of that. But what they could do is jeopardize their job because of the results of the behaviors that come when they're either burnt out or have mental health conditions. And so there's this stigma that physicians have about, we have to be strong. We went to medical school. We didn't miss class. We went to residency program. We stayed up all night long. And so there's that built-in part of training us for our career that keeps us on the rat wheel. Coaching is that part that helps them discover. So if we can get a physician into coaching, because that's one of the biggest things, the barrier of getting over the stigma. And I think going to a coach is less stigmatizing than if a physician has to go to a psychiatrist or to therapy. Okay, so I think coaching is that in-between place that's going to help physicians actually maybe open the door to seeking help. And when they start doing that, then we can get them off of the rat wheel. We can focus on their own discovery, their own needs, and help them achieve them. in my coach training, they say a good coach asks the best questions. Okay, and so it's those provocative questions that cause deep reflection and self-awareness, things like that, that's going to help move the physician from being stuck in this cycle into seeing possibilities outside of that cycle.
Coaching provides physicians a place to discover themselves and discover their needs because they are so preoccupied with fulfilling the needs of their patients and everybody around them that it is very easy for them to lose themselves and not be able to reconnect with what really matters to them in that process. So your coaching methods help them reconnect with themselves, reconnect with their life, with their inner soul, with them as human beings outside of just being a physician.
Exactly. And sometimes we have to remind them of that. Like, you were a person before you went to medical school, and you had interests, and you had hobbies, and you had things that you like to do with your friends and your loved ones. And then they get on that cycle and they fail to see how it's eliminating all of those pieces. And of course, when you add family into that, and rightfully so, your attention shifts, right? And so I'm old enough to be able to say that I can look back and see indeed how I shifted my attention from work to my kids, okay, and actually trying to keep that sense of balance. And not, I teach that there is no balance, because technically, if you calculate the hours, it's never really balanced. But there are boundaries, as you say. And so there was a time when I refused to look at patient information at home. And I didn't do any kind of late meetings, and I didn't travel nearly as much because my kids were younger. And then as my kids got older, I was okay with adjusting some of those boundaries to make sure I was fitting their needs, my needs, and my work needs.
In your coaching methods, Dr. Dewey, at one point you had mentioned you're a big believer in the power of positive intelligence. I'm curious about positive intelligence and how does that differ from emotional intelligence?
Well, I think there's a lot that can help support each other in those things. Emotional intelligence is more of through Daniel Goleman's work, okay, and that ability to self-regulate, be self-aware, use empathy, motivation, and social skills in order to interact with people in a certain way. And for us, that's a professional way in medicine. And one of those things we don't get taught in medical school, right? And positive intelligence is that part that helps you deal with a little bit of your own thoughts in those reactions, in those relationships with people. So I see them as being very intertwined and very important for both things. Positive intelligence is that part that, just like emotional intelligence, if you practice, you can get better at it and use it in a different way. So would you like me to go into a little bit more detail about positive intelligence here?
Yes, tell us maybe one or two exercises that we can do to enhance our positive intelligence, Dr. Dewey.
Okay. Well, first I'm going to say positive intelligence, I have to give credit where credit is due to Shazad Shamin, who had a grant and trained a number of coaches in this method, of which I was one of them. And what it is think about the conversation you have in your own head. Anybody who's listening, what things are you thinking that you're not saying out loud? Those are happening inside your head. He describes it as you have the saboteur side of your brain, which tends to be more rooted in a negative thought, self-deprecating kind of process that might tend to give you some success, but is truly sometimes more detrimental to an individual, versus using what they call their sage mind, or as we say in our sense, our wise mind, which uses a combination of both intellect and emotion in order to behave in a certain way. And so when you're driving, I have to use driving because that's my biggest problem, where my own saboteurs talk to me. He says that there is a judge, and the judge invokes one of the 10 saboteurs. Okay, and the saboteurs are the voices that tell you things that are rooted in your elemental mind that says this is bad, this is dangerous, this is harmful to you. And so in those 10 things, if I was driving and somebody cut me off, my first thought is going to be, you blank, right? How dare you, especially if my kids are in the car, right? I might almost say it out loud, but it's that part that tries to be defensive and save you. And then from that, it might exert invoke one of the saboteurs. And so then you start getting rooted into more negative thoughts, maybe about that person. And you don't even know the person because they're in a different car, right? And so what your sage mind does is it kind of looks at the situation and it helps you recognize to say, well, he might be in a bad mood today. Maybe this person is rushing off to find their loved one in an emergency room. It helps you think through what could be different possibilities so that you don't hold those negative emotions in yourself or attribute them to the other individual. And so in the business world, that might be more like scenario planning, right? For each situation, you think of a different scenario. So in positive intelligence, it's invoking the ability to think and use your cognitive abilities and your wise mind in a way that benefits you and your outcomes, as opposed to perseverating on these negative thoughts. And in medicine, what that makes me think about a lot is, especially for female physicians, with the whole imposter syndrome. And when they're telling themselves that they're not good enough, or that maybe they didn't get trained well enough, or whatever, those are your negative saboteurs. And what you want to do is learn how to practice switching into your sage mind, okay, so that this way you can use your reality, but you can also manage those thoughts. So one example, and I actually used this last week in a meeting where we had a group of people at our faculty wellness committee, and we had some idea about what our theme was going to be for the next year. And so what I wanted them to do was come up with a couple more ideas, or to build on the idea. And so there's one that is a yes and game. And so say you're in a conversation with somebody and they bring up something, or they make some statement, that's a terrible idea, right? Your saboteur is going to probably jump in there and kind of get defensive and things like that. But through your emotional intelligence and your practice of positive intelligence, you might say, yeah, what I understand about that is, and repeat what the person says, and then says, and what I also like about this concept is something. And then you extend it, and you try to also help the other person think outside of their own box, because their saboteurs are talking to them just as much as your saboteurs are talking to you. And so they use a combination, as I say, a mishmash of cognitive behavioral change and mindfulness-based stress reduction that helps you put the pause on the saboteur and allows you to switch into your sage brain. And so a simple mindful meditation he does and teaches us is a tactile sensation. We do 2, 5, or 12-minute intervals. And he talks about just rubbing the tips of your fingers together soft enough that you can feel the ridges on your fingers, and you're paying attention to exactly how those ridges feel. And what that is doing is kind of a mindfulness activity, drawing your attention to something that you're focusing in. And for mindfulness, of course, the most important thing about mindfulness is maintaining that attention. So every time your attention goes to a saboteur, then you might do this. So I have physicians who do this under the table, in their pockets. I have one physician who came up with this great idea. He's an interventionalist, so he's working with his hands, so he can't stop to do a tactile mindfulness activity. So he takes his tongue and he rubs his tongue along each backside of his teeth, so that he slowly counts all the way around and then all the way back. And he can do that during OR time or some other procedures in the office, and no one ever knows it. Okay, so it's calling your attention to be attentive to one thing, which takes the attention away from the saboteurs and allows your brain that calming piece that reduces the catecholamine, and neurobiologically, it allows your brain to actually calm down and have a little bit more focus.
This is
so
fascinating.
They call that PQ.
They call that what?
PQ reps, positive intelligent reps. It's like exercising your brain. It's like if you want to build your muscle, you have to exercise, right? So if you want to build your brain, you have to exercise.
This is fascinating, Dr. Dewey, and I can imagine how much patience and practice it would take to put these strategies into real life. Because when I imagine myself rubbing my fingers together, I can already sense my brain is flying, my attention is flying in 10,000 different directions. So to clutch that attention and bring it back and feel it in my fingers needs a lot of practice and patience. Is that right, Dr. Dewey?
Absolutely. And so, everything in mindfulness starts with the breath, right? So if you even just start with a couple of deep breaths where you start trying to focus that attention into your air as it moves in and out of your nose and into and out of your lungs, that's the part that starts to settle things. And then you go into a PQ rep. And he does different ones. Sometimes they're visual tracking and it's looking at different things. So he has a couple of different varieties. He has an app on the phone that you can actually use. It does cost money, but you can use the app to help train you. And you can start at 2 minutes, 5 minutes, or 12 minutes. And I do a variety of them. So depending on what I'm doing or what my stressors might be, I might need the 12-minute one or I might need a 2-minute one.
I'm almost inclined to think that attention is a muscle too that needs training, that has over time become so deconditioned because we haven't exercised it enough, that we need to rehabilitate our attention using some of these strategies that you are describing, Dr. Dewey.
Absolutely. And when you think about it, doctors tend to multitask a lot, right? They're talking to a patient and they're trying to take a note, right? They're doing note. They're walking out of the office and they're filling out forms in between, right? So their attention is always going all over the place. Or you're cooking dinner and the child's asking you a question about their homework, okay? So our attention is like all over the place. And then don't throw social media in there because that's just one more thing to take your attention away. But it is that, it's rooted in that practice of mindfulness, but it's also using that cognitive behavioral training to help kind of change your brain in from just what the saboteurs try to tell you into, no, that's what it might be telling me, but here's what reality is. Here's what I can do. And it's that part again, when I'm talking to women, and especially around the imposter syndrome, it's like, well, where in medical school did you learn that? And they're like, well, I never did. I said, then why do you consider yourself a failure when you have never been taught, right? No, I think physicians are extremely smart people, right? They have persevered through great, I won't say tragedies, but certainly challenges in their careers. And so they're resistant, gritty, resilient kind of people. And so what we need to do is just help them focus some of their own energy into what they really want.
This is fantastic work that you are doing, Dr. Dewey, and I'm a believer that you are saving physicians one career at a time. How can physicians reach you or any other healthcare professional reach you if they are interested in utilizing your coaching expertise and begin their journey towards wellness?
Right. So I offer coaching to anyone in the country or the world who's a physician, and they can find us on our webpage. If they Google Center for Professional Health at Vanderbilt, we will come up. They can click on the Professional Health and Wellness tab, and that will take them to an option for coaching. They can also email us at cph@vumc.org, which is Vanderbilt University Medical Center. So cph@vumc.org, or call us at 615-936-0678.
Thank you, Dr. Dewey. Thank you for joining us on Inspinar today and sharing your expertise about physician wellness, sharing the exercises so we can enhance our positive intelligence. Thank you so much.
Thank you, Dr. Gupta, and keep doing all of the good work you're doing.
Thank you. Thank you, everyone, for listening in today to Inspinar. Let's reconnect with real life. Let's reconnect with what matters. Let's reconnect with health, joy, and efficiency. Let's ungrip our devices and grip life. I will see you next time.